Okay, welcome to Tough Talk. It's a panel, a discussion on men and mental health. With myself are a number of experts and people who have knowledge about mental health. Briefly, there's myself, there's Dr. Abid Chowdhury, there's myself, there's Dr. Abid Chowdhury, there's Junaid Qazi, Idris Kennedy, Lutfi Pinelli. I'll give everybody a few kind of seconds to introduce themselves and their kind of background, and then we will get to it. So in alphabetical order, if Dr. Chowdhury, if you want to go first.
So I'm Abid Chowdhury, so I'm a consultant psychiatrist working in Wolverhampton and work currently in an inpatient unit. So dealing with kind of mainly adults who present with mental health problems. So yeah, that's my kind of background.
Okay, and Luth.
Assalamu alaikum, everyone. I'm Lutz Al-Nuli. I'm the counsellor and therapist at As-Suffa Wellbeing Practice. So my remit is basically working with adults with more mild to moderate conditions. So not as severe as inpatient unit like Dr. Abid, so probably more moderate cases, so such as anxiety, depression. So before they are at a stage where they require inpatient support, they would probably seek counselling. So that was my role, usually supporting them one-to-one in counselling.
Okay, and Idris.
Assalamu alaikum. My name is Idris Kennedy. I'm a final year student at the As-Suffa Alimiyah program. So inshallah, I'm hoping to graduate this year.
Okay, and Junaid.
Yes, Junaid Qazi. I'm hoping to contribute today in regards to experience with adults and children with mental health. I work as a support worker, and as a teacher, I've had to get involved with supporting vulnerable children and at times vulnerable adults too. So it's my input, hopefully, today.
Okay, and myself, Tabraz Khan. I am the head of sports services at As-Suffa. I'm also a former teacher, and I kind of lead on helping some of the kind of vulnerable people we kind of see at As-Suffa. I have got a bit of done a bit of training on mental health, but no an expert. And my kind of role is more to guide this conversation. And kind of discuss some of the kind of stigma and taboo around kind of mental health. Okay, so I suppose if we get into it, men and mental health. Is there an issue? Is there a need for this discussion to be happening? Why are we wasting an hour on a Sunday evening talking about this?
Is that a question?
It's open. Just jump in. I'll pick on certain people if need be, but feel free to jump in. Dr. Abid.
Yeah, so I guess from my experience and working in mental health, so over the last 10 years or so, I think initially when I started training in psychiatry, I don't think we used to see many Muslim patients. There were, but it was kind of fewer. But I think over the last 10 years or so, we're seeing a huge kind of increase. So in services, particularly, I would say between the ages of, from kind of what we call CAMS, so school-age children, up until the age of 25, there's a huge increase. And I think that's been recognised because the service is set up now just for that age group. And what we're noticing in those, when I've worked in there, is the majority of the people there are probably Muslim patients coming through. And I think still that issue remains that people usually will try everything else before accessing mental health services because of stigma and certain, kind of views that they have about what mental health services are like.
Okay, so sorry to interrupt there, but okay, mental health, we hear of terms like if someone's kind of bipolar, schizophrenia, things like those. but generally, and obviously we'll see more often women talking about mental health or a lack of, positive mental health and stuff like that. Generally, men don't talk about it, and the assumption is we as men are more resilient. It doesn't really affect us, so is it an issue which affects kind of women more than men?
Not necessarily. I think I think men tend to seek help a lot less, but it may be that they seek help a lot later. So, for example, rates of suicide will be a lot higher in men than women, because they're likely, not likely to seek help, and it reaches kind of breaking point, and that's when you get to know about kind of men probably presenting in crisis. So I think that, generally the figures and the rates of mental health problems are very similar. Maybe women may present with more kind of anxiety disorders and things like that. Mm-hmm. But in other cases, it's fairly equal. But I think it's a case of accessing help is the problem for men generally.
Okay, all right. What mental health? So what is mental health? What, when we talk about mental health, what is it? Is it a, like I said, I kind of mentioned some of the kind of disorders you might see, which are kind of higher spectrum. But what do we mean by mental health, Ruth?
So mental health would be usually related to some type of dysfunction in your general well-being that's kind of unseen. You can't quite put a finger on it. Usually with physical health, you can see outwardly that there's something wrong. So for example, you go to the doctors and you've got something, you've got I don't know, you've broken your elbow or something, and you require a surgery or something. You can see there's a physical issue. Usually with mental health, there's an issue where you can't quite see what's wrong. Something's not quite right. You're functioning, your daily life has been affected in some way. You're not quite moving around like you usually did before. You're not working as well as you used to. So there's some things not quite right. You can't quite place your finger on it, and that's usually what we refer to as mental health. And usually that covers things such as anxiety disorders, depression, loneliness, even now as well, and things such as stress-related conditions as well. So these are, conditions that are quite unseen. Usually they will manifest in certain, they have certain symptoms like with every illness. But usually what you'll see is that the cause is quite, it's related to some type of event or something, some type of fear or some type of, trigger that's causing this type of dysfunction, really.
Okay. On one side, somebody might say, I get that. But look, we all have stresses in life. Okay, the predominant role of a man is as kind of breadwinner, or to kind of provide. There's different stresses in life. Surely, it's part and parcel, and some of these mental health disorders or conditions seem like they're almost kind of exaggerated. Because if I think back to 20 years ago, you never heard of mental health. When our kind of fathers or grandfathers kind of came from wherever they came from in the world, they had a hard life. They had less money. They had more financial pressures. You could argue they were responsible for more people. You never heard of anxiety, depression, signed off with stress. So is it really an issue, or is it just people being weak?
No, I think mental health or illness mental illnesses have always been present, in since the kind of the dawn of time, I guess. I think we've always had these types of stresses, like you said. I think the only thing that's different, that's changed maybe, is that the ways we've kind of found or managed them, the ways we've tried to cope with these stresses. And now that we're finding in today's society that we've become a lot more isolated, we've become a lot more, fragmented as a society, really. A lot more people are, living on their own, especially here in the West. compared to, you know, where our parents, our grandparents might have come from, which is very much communities, you know, social communities that are quite, you know, thriving really. And I think that there was always someone, you know, maybe in the village that you would kind of go to when something's not quite right. You know, maybe back home there was an auntie, an elder figure that you would kind of go to when you're experiencing, you know, maybe relationship issues or you're going through a difficult time. You would probably go to speak to them. And maybe they would have been quite knowledgeable and, you know, been able to support you, similar to how we would do maybe in counseling. You know, there would be that figure within the community that you would kind of go to, you know, confide in really. Whereas today, because we're so fragmented, we're on our own, we just don't know how to cope. You know, we don't know the strategies, the ways to kind of manage these types of mental health issues. So that's why there is a need to kind of have services, have organizations that are set up to kind of support people in our current societies here in the West and even back home now as well, where we're seeing similar issues.
Okay. Now, generally, mental health, especially, you know, isn't spoken about in the Muslim space as much. You know, we hear about, you know, domestic violence. That's, you know, kind of, and rightly so. That's kind of, you know, talked about a bit more. But generally, within kind of Muslim space, obviously in the you know, kind of wider space, you kind of hear mental health seminars, and you hear kind of, you know, campaigns happening, but not really in the Muslim space. Is it? And obviously, so one might kind of argue, you know, in terms of from a spiritual point, if you got a religion to kind of rely on, you kind of got some kind of support base. So is mental health a problem for Muslims? Sadris?
So yeah, I mean, of course, the whole essence of Islam, and you could expand this wider to other religions, is the acknowledgement of a soul. And sometimes when we talk about mental health, it seems, and obviously that medical professionals can advise, but it seems there's a focus on the mind, and that this is a mental problem in the brain. But from a religious perspective, we're made up of a physical body, a rational mind, but we also have a spiritual soul. And a human being to be balanced, certainly from the Islamic perspective, is to have these three elements all in balance. And so the first thing is to recognize that there is this thing called a soul. And, you know, I'd be interested to know whether the medical world, do they recognize this thing called a soul, or is it purely just this material, you know, substance within our brain? Because from an Islamic perspective, and this is where Islam can really, I think, has got something to offer, is that unless we conceptualize the human being, what does it mean to be human first? Unless we've got that conceptually correct, how are we going to treat any of the issues? So if we deny that there's a soul, then we're hamstringing ourselves in terms of solutions. So ultimately, from a believer's perspective, that Allah subhanahu wa ta'ala says, الْيَوْمَ لَا يَنْفُ مَالٌ وَلَا بَنُونَ إِلَّا مَنْ أَتَى اللَّهَ بِقَلْبٍ سَلِيمٍ. That on the day of judgment, the only one who is successful is the one who comes to Allah with a sound heart. So this heart, which is the essence of the believer, needs to be sound. And the word sound doesn't mean without scars or without difficulties. A sound heart will have been through, maybe it's gone through hell and back, but at the end of the day, it's sound. And what does it mean to be sound? That's obviously you know, a wider discussion, but that's the core of the believer. This is the core, the message of Islam and all the prophets, is to allow the believer, the human being, to have a sound heart. And so I think many of the discussions regarding mental health, they do link into the concept of the soul and having a sound heart. And I'd say it's the absolute essence of Islam to help a person arrive at a sound heart. So it's a real issue. The Prophet sallallahu alaihi wasallam himself dealt with it with his companions. All the prophets, they went through sadness and grief and, you know, emotions of happiness and sadness. And so, you know, it really is an issue. It's something that's addressed by this religion, and something that we should and must take seriously, because it's the very success of our being.
Okay. What's the danger? Okay, ignoring it. You know, as for some people, put your head in the sand. You know, it's a problem. It will pass. Either you kind of just wait for it to pass, or you just know there's a problem there in total. Is that a solution, Junaid?
Sorry, I just want to understand what Idris was saying about Islam giving a solution. Do you think that people actually use the religion for their own actions to justify it, and therefore mental health is actually misunderstood amongst people who are practicing Islam?
Could you give an example? For example,
if there are individuals who want to justify their action, that, for example, they don't want to do a certain act. I don't want to go into any specific, but they will use religion. For example, I don't need to look after. I need a charger. I don't want to look after children because it's not my right to look after the children. So, is there something in regards to, because they've not understood, they don't want to do it because of religion, or is it because their mental health is making them think that they don't want to look after the children? Do you understand what I'm trying to ask here?
A little bit. I'm not entirely 100% sure, but religion sometimes is used. It can be used in a positive way, and religion can be used in a negative way. I think sometimes I've heard it referred to as spiritual bypassing. So religion can be used in a positive force to recognize and diagnose problems and help offer solutions, but it can be used in a negative way as well to put up barriers. You've got weak iman, for example. Just be patient. If you've got difficulties, just be patient. It's Allah's will. And so this would be using the religion in a very negative way. And when we say spiritual bypassing, meaning there's a core issue, and rather than deal with the issue, you bypass it and just say, be patient, it's Allah's will. And so this would be, using the religion to avoid dealing with the problem rather than actually addressing it. And so, because it's got a religious name, be patient, Allah says be patient, accept Allah's will, you're Muslim, people then feel bad to kind of challenge that because those are religious names and there's religious terminology, and they feel bad. Well, actually, that doesn't make sense. And so it's important for all health professionals and imams and teachers to highlight this, that we have to address the issues at hand and not use the religion as kind of like a barrier and stop people from addressing the problems, dealing with them, asking questions. So I don't know if that helps, using religion in a positive and a negative way, if that's what you're referring to.
Thank you.
Does Islam actually advocate men to be a bit more open about their problems?
So I would say, looking at the life of the Prophet ﷺ himself, he openly shared his problems, and especially with his family. You look at when he received revelation first, the first place he ran, and he was feeling a lot of anxiety, fear, uncertainty. What happened when he first received revelation? A momentous occasion. The unseen had become. He'd been exposed to the unseen. Like, imagine being exposed to a black hole. We would be like crushed under the pressure. Imagine being exposed to a portion of the unseen. So the Prophet ﷺ was uncertain. He was in fear. Where did he go? He went straight to his wife, and he offloaded his problem to his wife. And likewise, in his moments of joy, he did the same thing. When he returned from Isra wa Mi'raj, not many people know, but he was staying at his cousin's house, Hani, his cousin. And this was the year of sorrow with losing his wife Khadija and Abu Talib. This was known as the year of grief, the year of sorrow. Where did he stay? He stayed at his cousin's house, Hani. So he was there consciously. His cousin was hosting him because of his difficulty. And when he returned from Isra Miraj, he went back to his family. And so he was sharing his grief, his difficulties. He was staying at his cousin's house when he was so they knew his problem, his grief. So they were open, like with his companions as well. He found his companion Abu Umama was sitting in the masjid. And the Prophet ﷺ went up and asked him, what's the matter? You look like you're in difficulty. And this is where the dua that we all we all know. اللهم إني أعوذ بك من الهم والحزن وأعوذ بك من العجز وكسل وأعوذ بك من الجبن وبخل وأعوذ بك من غلبة الدين وقهر الرجال, which is, oh Allah, we seek refuge in you from anxiety and sadness, from laziness and incapability, from stinginess and cowardice, and from the overpowering of debt and being overpowered by people. This dua was actually revealed or was told by the Prophet ﷺ because he met Abu Umama sitting in the masjid who looked in grief, and the Prophet ﷺ went up and asked him. And so the Prophet asked why was he in grief and sadness, and Abu Umama fully shared his problem as well. He fully shared. He said, Ya Rasulullah, I'm in anxiety, I have uncertainty about the future, and I have a lot of debt. So the Prophet ﷺ asked, he shared, the companions shared with him. And so I don't know why there is a stigma, because if you look at the Prophet ﷺ's life, he was sharing his problem with his most closest relatives, and the companions shared with him. And there was no, who else are you going to share your problems with except your spiritual guide, your leader, the person you look up to? So that's the sunnah and the way of Islam. So anything else, really, it's I'd say it's contradicting Islam, is to hide your problems and not, address them when they need to be addressed.
Thank you. Dr. In a conversation we had before, you mentioned you've seen an increase in the number of Muslims being referred to your service. So I'm assuming the type of people you see are a bit more kind of advanced in terms of the mental health disorders, correct?
See, it's kind of a mixture. So I've worked in the community as well. So we get referrals from the GP who may be early onset kind of presenting with symptoms of mental illness. Obviously, inpatients, it's usually people in crisis who are acutely unwell. They'll get admitted. But the kind of things, I guess, that we're seeing, it's a mixture really. So I think the inpatients, I think, like Ustad Idris said, there's a difficulty with the Western model of psychiatry. So I think we deal with acute mental illness fairly well. If someone is clearly psychotic, hearing voices, very disturbed in their behavior, medication will help and you'll treat them and they'll get better. We kind of see that, within a few weeks, it's a changed person. I think the difficulty is the more chronic, low-grade kind of people really struggling with stress, difficulties in their life, this concept of the soul, it isn't really there. And so those cases become very difficult. I think for non-Muslims, it's extremely difficult because then they have nothing to fall back on, because there's no deen, there's nothing grounding them. So when things break down, the only answer really is, I'm going to kill myself, because actually there's no way out. But for Muslims, the sad thing is that we're seeing that same pattern now because of the way society is, and as Lut was saying, the breakdown of kind of family and not having somewhere to turn to. I think a funny example that I always kind of share with people is when we used to be on call. So we used to get called out to A&E middle of the night, and the A&E kind of medical team would call us, the psychiatrists, and say, we've got a patient who's suicidal, can you come and see them? And we would go with a nurse or someone else, and we would see the patient, and we'd spend 40 minutes, an hour just speaking to them, and probably send the patient home after it, with some support and things. And they would say to us, like, what do you actually do what do you do? How is it that when we see them and they're saying we're going to kill ourselves and this and that, and then you end up sending them home? And most of the time it was nothing but letting them offload and just listen to them. And, maybe you can kind of relay some things back to them and actually reflect that it's probably not that bad. And, with a bit of support, things could improve. And that's what they needed, but they don't have anyone to offload to. And so they end up in hospital or, and things like that. So it's a difficult, I think, kind of, but in terms of the question you asked, in terms of what we're seeing acutely, I think in the younger population, what we're seeing is a lot of drug-induced presentations with young men.
Sorry, what is, for someone who's academically trained, what does that mean?
So people using cannabis, young guys, even girls, cannabis, other kind of street drugs now, like legal highs, which people are using, and then obviously other drugs which will end up causing people to become psychotic, losing touch with reality, and then end up getting admitted. So there's a lot of that in that kind of age group of 20s, late teens to 20s. And then the other thing I would say more so with females is the kind of just trauma related presentations. So I think another thing which we don't talk about a lot, I guess, within our community is trauma, abuse, and things like that, which are kind of seem to be rife within our community, but again, not being addressed. And that's causing huge problems with mental health presentations.
Appreciate that. Okay, so we've discussed a few things. We've had a few questions, different people. Is there anything anybody wants to add or comment on what we said so far?
I would like to say, just based on the last year, we've set up the wellbeing practice at As-Suffa, and over the last year we've seen a number of people, and I think I was looking at the amount, the ratio really from male to female before we began, and it's about 40% male and 60% female. So alhamdulillah, we are the men, in our community who are, aware of the service, are seeking support, so it's fairly even in that sense.
Mm-hmm.
So there is some awareness, and I think our role as people in the field, or people in contact within the community, is to kind of raise that awareness and try to kind of make it more, how would you say, make it okay, normalize it, to make it okay that to seek help, excuse me, and to kind of seek support when you notice that there's something not quite right, or you are in need of some advice or some guidance in some way, to reach out to a social worker or a medical professional, or seek therapy or counseling, or seek religious guidance even as well. I think that's probably the first place that we should go to, and then from there you can sort of branch off to and sort of signpost.
That's
as
interesting.
well.
Thanks, Luther. I didn't actually realize. I would have thought generally more women would have been using the counselling service, but it's good to see that there's a bit more mix. Okay, anything else anybody wants to add or comment on?
I think just to say that, so I think we did a piece of work kind of a couple of years ago where we interviewed religious leaders, so imams in mosques and like organizations, just to see their awareness around mental health problems. And what was quite clear, that I think mosques that had Western kind of educated imams who had grown up in the West and then studied and then kind of taken a lead, were getting a lot of people approaching them about mental health problems.
Okay.
From the community. And they were struggling at times to kind of know where to direct and where to send these people to and what to do. And then you had the kind of more traditional mosques where people were still approaching them with issues, but they really weren't sure. Again, they would either just say go to your GP, or they may divert them towards some sort of other spiritual advice or things like that. And so I think it was quite clear that, again, there's a lot of delays which lead to people accessing mental health services, but people do turn up to mosques and kind of organizations a lot of the time first to kind of seek help. And I think maybe having like this counselling service you've got in As-Suffa, in more kind of wider places where people can access just somewhere to speak to people, I think would really open up kind of access, I think, for people to feel, maybe I could just go and speak to someone there, or yeah.
Okay, sure. Junaid, you've been very quiet. Anything you want to add?
No, I just want
to like you to be quiet.
Yeah, no. But I was reading somewhere that mental health issues are less amongst the Asian community, in particular the Muslim community, because the culture and the religion has an emphasis on family support unit. So when people are suffering, they have the support framework around them. However, I think recently, like Brother Abid was saying, that there has been a rise amongst the Muslim community having mental health issues. It may be because of the family breakdown that's happening now, the framework that was used to be available because people used to adhere to certain cultures and practice of Islam are not doing so right now. So people who are moving away from Islam and from religion are finding the culture that they're adopting is actually having a counter result on them.
But I think
So, do you think it is that that framework around the Muslim community that used to exist amongst at least the family doesn't exist anymore? Therefore, the problem has arisen, and we need to work towards rebuilding those values amongst the Muslim community and about family unit, because that would be important. The initial people who you would try to communicate if you feel that you're suffering with trauma, or you're dealing with some domestic violence, or you're dealing with something that's causing you to cause anxiety, would be someone within it's usually within your family, someone within the family. So we need to work on those values amongst the to build those values to tie in the unit.
See, unfortunately, I think society in general, you've seen a gradual kind of breakdown in family structure and family values over time anyway, both within the Muslim community and the non-Muslim community. But look, I suppose one of my kind of follow-up questions was going to be, how can we help each other? I suppose there's one in terms of a large unit, in the family unit. But if I'm having a slightly kind of tough time, I'm more likely to speak to my friend than go to see my GP, because there's a whole. Whereas I'm happy to go to my GP regarding any small physical ailment. I don't have an issue. But when it comes to stuff of the mind, you're like, you know what? Yeah, I don't want to be seen as weak, or I don't want to. Maybe the guy might give me antidepressants or something like that. So generally, I suppose as men, we're a bit more reluctant to kind of seek professional advice. So how can we as individuals help each other? So if somebody is having a chat with us on a friend-to-friend level, how can we advise without? Sometimes we just kind of stay stum. Whereas if it's a medical advice, or even from a scholarly perspective, we're not a scholar, we're happy to kind of give, the fiqh perspective is X, Y, and Z, even though we don't know anything. But how can we help, in terms of the mental space? Luth, Dr. Abid?
I guess, I think, as we said really before, I think that the more kind of places you've got where people could access kind of just people to talk to on a one-to-one, or that kind of setting on an informal basis, I think would allow, it's making it kind of comfortable for people. And I think when you're struggling, as you said, you're more likely to speak to a friend, and a lot of people, if they have a good friend, they'll probably be able to offload to them and feel a lot better. Sometimes when people get very isolated and they don't have anyone, I think those are the kind of people you need to really look out for, and take them in. And sometimes, it is about keeping an eye out. I think, in mosques, and you may see people who are struggling and just approaching them. And I think that concept has been lost. We kind of tend to probably just turn our head the other way and walk past, even though we know probably there's something not right with that person. But that kind of just, keeping an eye out, giving people some space to just approach people, and giving them time, I think it's probably one of the main things really that would help.
Okay, and how can we help ourselves? Okay, so I'm, say if myself or somebody is going through a tough time, there's circumstances around me, and you're feeling a bit kind of, overwhelmed. What can we do?
So I guess there's a few things, isn't it? I think one is your, in terms of mental health in general, there's going to be, usually we're not sure of an exact cause for any of the mental health problems, but usually it's a combination of multiple things. And there's basic self-help things that people can do when they're struggling. So as we said, speaking to someone, trying to maybe do some exercise, getting out for walks, basic things that will just help develop routines and just improve their general well-being. But I guess it's when things really start, when people start to struggle, so they're not able to really do their day-to-day activities. If they're not getting able to get out to work, they're struggling with their relationships at home and things like that, then they probably need to seek some more help to get a bit more kind of support, because it may not be enough for them to just pick themselves up almost.
Okay. Lud?
I would say, yeah, I would completely kind of echo what Dr. Abed's kind of said there. And also, let's highlight the importance really of, education, sort of, educating ourselves really on difficulties that, we inevitably kind of experience in life, and how to kind of respond to them appropriately, in a way that's, productive as well, not to kind of keep things inside, and to offload, as we've kind of been discussing throughout, really, and emphasizing throughout, to not keep it to yourself, to share it with a friend to begin with, maybe, or a family member, and then to see how that goes. If it's still persisting, then maybe to take it further, but I think to keep it within can, it can build up, and it can cause, as we've said, other issues as well, and combined with other stresses and triggers and life events, it can sort of compound into something a lot larger. And then usually what we found, and especially in men, because there's this sort of stigma and taboo around the whole topic, is that they are committing suicide, or close to. So it's important to address it quite early, and to to make it okay, as I've mentioned earlier, to speak about these things with our friends, with our family, and sort of normalize it. And then hopefully things we can identify things that we can access certain services as well within the community that are available, and be more aware of those as well. But I think, first of all, to offload and to share with our loved ones, those who are close to us, confide in them, see how it goes, and then maybe to seek other support services, education as well on the topic as well. Things like this, I think conversations like this do help, as it probably doesn't seem like we all sat in our own rooms, all away from each other. Ideally, as the brother said, we'd be around a table with cups of tea, and we were able to have that sort of human connection, which is another thing, being connected with other people. Usually what we find is when we're isolated, that's when, it started, Reese will probably mention this as well, the waswas and the sort of the whispers can sort of take effect on you. And that's, as we sort of consider within the holistic, understanding of a human being with the soul, is that there are whispers, and there are these sort of influences within the world that can take effect as well. So it's to kind of improve our understanding, have conversations like this, reconnect ourselves with other people, with nature, and try to kind of almost synchronize with nature as well, in a way. So I think these are several ways that we could do to raise awareness, things that we can do to kind of improve our conditions, I guess.
Perfect, thank you.
It's like they say, problem shared, problem halved, especially
Yeah.
over cup of tea.
Yeah, I think there's a really, I don't know if any of you have seen, there's a gentleman, his name's I think Kevin Hines, but he was a chap who he survived a jump off the Golden Gate Bridge in America. So he was walking along this bridge, completely kind of broken, you know, and he thought, you know, I've had enough of life. And he got to the point where he's standing by the bridge, ready to about to do it, and somebody walked past and asked him, "Can you take a photo of me?" So he took the photo, and he said, you know, obviously he was distressed at that point already, thinking of jumping, and he just thought, nobody cares, you know, that somebody could ask me to take a photo when they can tell the state I'm in. And he jumped. After he took the photo, he jumped, and he said he survived. And he says that as soon as he jumped, he knew that he didn't want to die. And so he changed his jump to a dive, and he ended up with severe injuries, you know, but he now goes around doing talks about mental health. But that split second of, if someone had just spoken to him, probably would have changed his whole perspective. And I think it's so important, but I think, you know, it just doesn't happen enough. I think, you know, it's for a lot of people, they either find it difficult or they
I think something to add as well with that story is that I think what he said is, I think as well, just to add, is that I think he says something like, if someone asked me how I was that day, I just wanted one person to ask me, you know, how I was doing, otherwise then I wouldn't have jumped. You know, he just wanted one person during his day to, you know, to ask him how he was doing. So things like this, you know, when we see others around us that are, you know, keeping things all to themselves, or, you know, seem like they're struggling in some way, or may not even be struggling at all, just to kind of ask them, you know, is everything okay? How are you? You know, not to go into too much detail. You don't have to, or be nosy even, you know, you just have to, I think, keep it, you know,
see, you know,
that way.
When you're younger, you kind of told smiling is a sunnah. And as a kid, it doesn't make sense. You're like, okay, fine. You're telling me I'm grumpy, I should smile. But one thing you're not going to notice is if you kind of walk somebody and you smile at them, they kind of smile. And that kind of reciprocates. And obviously, he's kind of mentioned about, obviously, is there an idea of how the soul affects the kind of body? And I think if you go to various kind of mental health kind of courses, I think at the mental health first aid, they kind of mention the impact of your diet on your mental health and the impact of physical exercise on your mental health. So obviously, small things like that, you're changing something small in your physical body, is going to have an impact internally as well. Well, so I suppose we've obviously you mentioned about the kind of spiritual aspect, and you mentioned, I think there's this kind of misconception that there's somebody that think we should have patience, but we should do something about it. So also seeking help isn't contradictory to patience, or seeking patience. But you know look, I've kind of come across and met people who are like, you know what, I have tawakkul, I'm going to, you know, be with me, everything's going to be fine, and Allah subhanahu wa ta'ala is testing me, and it's a test, and, you know, so therefore I should go through this hardship, or go through whatever it is, because it's part of the kind of bigger picture. And some people, mashallah, are resilient and are able to kind of come through it. And some people, you find it shatters them, and they kind of almost kind of turn away from religion, thinking, you know what, it made things worse. Where do you find the balance?
So I mean, it's an interesting, it's almost like a paradox, because like you said, you know, the world is created in a particular way that the hardships, a certain level of hardship actually develops it into our full potential. The world is created like that, but it's when that difficulty exceeds a certain limit that we can't handle, then it gets into a problem. And so Allah has created the world in this way, and so, like, you know, imagine like bright light. We can't see in just pure light. We need that contrast of light and dark in order to see, and you know, that creates shadows. And that's why Allah subhanahu wa ta'ala, he says, that he takes you out of the darknesses, the shadows, into the light, because the world is full of light and darkness, shadows and the light, and we often get stuck in those shadows, but really those shadows are only there because of the light. And the whole purpose is for us to be able to recognize those shadows, grow because of them, and come into the light and become better as we are. I mean, any discipline, you have to be restricted, and through restriction comes freedom later on. Like, you know, everyone here is professionals or has gone through a strict level of discipline, and that freedom comes later. And so life is no different to that. And I think that connection with Allah subhanahu wa ta'ala, understanding how this life is extremely important, because we have uncertainty about the future, yet at the same time as believers we are supposed to have bil akhirati hum yunqinun, that in the akhirah they have total certainty. We have yaqeen, total certainty, yet this world is full of uncertainty. And so it's managing these things, that our certainty comes from our connection with Allah subhanahu wa ta'ala, and managing our own reliance on Allah subhanahu wa ta'ala. It helps us through, like you mentioned, people can strive through because they realize life is full of difficulty, and sometimes, you know, embracing that uncertainty. Anxiety is about uncertainty about the future, and I think we need to embrace it. We live in a time where we can check the weather at the beginning of the day. We put in our sat nav details even if we know the route. Like we're trying to, as creatures, create a lot of certainty, and sometimes demanding certain level of certainty is actually contradictory to our nature and the world around us. And we need to maybe embrace uncertainty a little bit. That uncertain level of uncertainty is healthy, it's good. That's how the greatest inventions come, by not knowing and going to seek and try and find out and making mistakes. And our greatest growth often come. Look at that brother that you mentioned who jumped off the Golden Gate Bridge. He was in that shadow, in that darkness, and you know, he survived. But because he survived, we now know what a person who jumped off the bridge, what they thought. They thought that, I don't want to die. Now, had he not survived, had he not jumped and survived, we would not know that. And so these shadows, these difficulties, they exist for our benefit. And so I think it's about embracing that and supporting each other, because when I'm strong, you might be weak, and when you're strong, I might be weak, and supporting each other with that compassion. I think that's it's a healthy thing to go through difficulty and uncertainty, and as long as we kind of support each other, I think it can be a very positive thing, Islamically as well.
So, Sheikh Idris, can I just ask a question, please? Where does qada and qadar come into life? If these points were part of the education process in our masjids, in our madrasas, do you think that would assist these people who have a misunderstanding or are suffering with mental health because they are worrying about matters that are beyond their control? If we understood about qada qadar and we actually as Muslims believe in that, there would be less of a confusion and more less of a problem. Do you think they would help if it was part and parcel of our education process?
Yeah, I think so. I mean, any solution is going to be holistic, physical, mental, education, spiritual. It's going to be a holistic thing. But yeah, definitely, like, religion can be used as a blocker or as an enabler, and that education is really, really important, about qadr, about sharing your problems, as you mentioned. Even myself, after I've done talks, I've actually had one person came up to me, and I found out, now I'm still in touch with them, alhamdulillah, 2 years later. I found out now that when they came to speak to me, they were on the edge of giving it all up, Muslim. And it was just that care and compassion, just to listen and, listen to their problems. Had I, sometimes I did get worried that this person, maybe I need to refer to professional help. And so me as a kind of a teacher, untrained in this area, you need education for us as well, because these people come up to ourselves and being able to handle it outside just normal compassion. So education for both, I think, is key.
Okay, sometimes if you look at society or look at what the measure of success is, a higher income, a better standard of living, and generally, as I said, even though the norm is generally, or the expectation is the man is supposed to provide. So as men, we're like, great, it's our job to kind of go out, work, bring this income in. So are we creating issues for ourselves? Are we trying to strive for this certain level of income? And therefore we're creating kind of extra kind of mental pressures on us to kind of achieve that.
I think it's possible. Yeah, I mean, the reality is, you know, where is our focus? You know, what are we looking? If we realize we're here for a short time, we need our, you know, if you've got your priorities in order, then everything's in its right perspective. But if you're just chasing after the next goal or the next pay rise, and there's nothing else, then that will definitely be, you know, part of the problem. Comparing oneself to others, it's a big thing. You know, I mean, a couple of years ago, I remember Selena Gomez came on BBC. She said she was deleting her Instagram account because it was causing her anxiety looking at everybody else. And I was like, you know, she's got 150 million followers. Everyone is probably full of anxiety looking at her, comparing themselves to her. Yet she's the one, you know. So it's this comparison, you know, comparing ourselves to other people is a massive thing, because the problem is you're comparing your internal reality to their outward reality. You don't know what's going on behind closed doors. So you compare an inward reality that you know inward and out to just an external, and the comparison is not correct.
Yeah.
And so that's why, you know, the Prophet sallallahu alaihi wasallam, he said, look at people who are worse off than you, and you'll be grateful for what you have. And so definitely where we put our focus and how we frame things is really important. Comparing to others, and the dunya is like a shadow. It's like a shadow. The more you chase after it, you'll never catch it. And you know, this causes problems in a whole range of areas. But alhamdulillah, the deen, religion, gives you the focus, which is essential.
Dr. Abbott, I think you wanted to say something.
No, I think echoing that, really, in that the influence of social media now and the impact that it's having really on people's mental health. And I think it's just it's like a ticking time bomb and getting worse, isn't it? I think from, you know, if you see from teenagers onwards, all they're seeing is this external reality of people thinking that life is like this, whereas they don't know the reality, isn't it, of what their life is actually like, but they're trying to chase that. They're never going to reach that, and it just creates disappointment after disappointment, and, you know, just anxiety. But really they don't know what those people's lives are like. They're seeing just this external kind of facade of glitz and glamour and everything else, but it's a real problem. And I don't know, I think these are the kind of things that we talk about, but it's really difficult to manage and control. But I think we have to raise awareness amongst, you know, youth, but also adults, and because it's a real problem in general. I think the impact that social media and all these things have on people's mental health, without them realizing, I think that it is having that effect on them.
See, I received a comment a couple of days ago. As part of this campaign, we're kind of sharing kind of different images and videos. So somebody said, you know, as parents or as kind of elders within a family unit, how can we help our children or teenagers? Because, you know, as you said, part of it is social media, but part of it is, you know, they are experiencing pressures.
Yeah.
And it's not so normally from a parenting point of view, like, okay, teach them right from wrong or whatever, or academic help or stuff like that. It's not something normally you kind of think about. How can I help my child have better mental health? Where do we start?
It starts with ourselves, doesn't it? I think you have to first start with yourself and sort of educate yourself, and like we were saying before, and then, you know, try to work on those closer to you, you know, and work with them and try and educate them as well. So things I think would be practical things that we can do is to have this type of understanding at an earlier age, you know, to teach young children and young people the sort of the harms of this as well, of this sort of social media addiction, like we're calling today. I was reading somewhere recently how the attention span of people has significantly decreased over the last few years in university students anyway. And you can see this with things like TikTok and Instagram. They're very short. They're designed in a way that's gonna get your attention and try and hold it for a short period of time. And then usually what you'll find is you'll swipe to the next thing, and then you swipe to the next thing, and then it's a constant bombardment really of things designed to grab your attention, and where people are finding it a lot more difficult now to actually hold conversations. And we're seeing a rise in things like autism as well, which is also, of course, diet related as well, and as other factors to consider. But these are other things that we should pay attention to, I guess, as well, to limit, especially young people, their exposure to these types of devices, iPads and laptops and screens, TV, to kind of before the age of 10, really, like when a child's brain is still developing, it's probably more harmful to put them in front of a screen and show them all these images of perhaps violence, because kids, what they do is they'll just copy what they see, isn't it? And if they're seeing this all around them, and they're seeing that it's okay to be in this type of environment, and they kind of they think it's okay. So I think as parents maybe and teachers, is just to kind of be aware of some of the dangers and harms, and to kind of try and implement them, first of all for ourselves, and then our families, and then obviously to kind of share it with others as well.
Okay. How can we help to do more to break the stigma? For example, we will be comfortable asking somebody to help us find us a car, as an example. But if somebody needs help managing the finances, even if they get to the bankruptcy stage, they probably will some people will start reaching out for help at that stage. So yes, basically the question is, how do we help do more to break down that stigma? Junaid.
Sorry, I'm going to reverse that question and ask As-Suffa, Taz, what are you guys doing in regards to that?
Well, this campaign is the start of it, but we'll go back to you.
Explain how is this campaign actually going to break this this stigma?
Okay, look, all right, I didn't expect to answer your question on this one.
Yeah.
All right.
It's to yourself and Dr. Luth, is it?
Yes.
His brother, yeah, not doctor, not doctor yet.
Yeah.
So first of all, it's look, we realize there's an issue around the whole dialogue in the mental health, in the Muslim sphere around mental health. Now, we've chosen this year to focus the whole kind of week-long campaign on men and mental health. And some people are saying, well, why are you ignoring females and stuff like that? And obviously, inshallah, we are going to do stuff around that as the kind of year progresses. But we felt there's almost a taboo talking about men and mental health. And there's a general expectation that the manly thing is, you know what, you're a man, you can deal with it, be quiet, move forward, and you should be more resilient. You should be able to kind of take it like a man. And we're almost kind of told and pre-configured how to act from a young age. We're told, look, boys don't cry, or X, Y. This is a certain kind of stuff you're told as a child, which kind of stays with you and kind of almost kind of programs you as you grow up. So we felt there was a need for this kind of conversation, especially for men. So we're doing various things. Obviously, we've got a series of videos out this week. Obviously, you're kind of a part of one of those videos. We're doing obviously this conversation. We've got kind of different kind of media spots on the radio and TV. We're speaking about this kind of issue, and the hope is, number one, just to start a conversation. Somebody might see like 5 minutes on this on YouTube, and it might strike a conversation. Actually, for somebody to actually ask, genuinely ask, how are you, and really kind of mean it. That if only achieves that, it's had some merit. And then obviously we do have the counselling service. If somebody is does want to book a session with Luth, they can do so. If somebody wants to, we also have a listing service which they can ring up, and it's almost like a Samaritan for Muslims, I suppose. It's whatever kind of describing it. You kind of ring in, and we have a listing service. We also have a support line where you can ring us and we can signpost to other organizations, because we are not a mental health charity. We're basically a Muslim charity. Predominantly, we do stuff around education, but then it was like, our kind of motto is the best of people are those who benefit mankind. So it's like we're teaching people more about the deen. We're teaching people to become alims and leaders of the community, but therefore we should also be helping that community as well. And Brother Idris, he's obviously, inshallah, he'll be graduating this year. And he's one of the kind of future leaders of the community, and he's already doing a lot. So we kind of feel like we have some responsibility as an organization in the Muslim space to say, you know what, we should be doing more. But inshallah, the hope is over the kind of course of the year we'll do more. But as an organization, we have limited capacity. So it's more about people who are experts in the area kind of coming forward. We do need volunteers to kind of come and lead on certain projects and to help us do more. Because realistically, it's easy to kind of point fingers and say, oh, you know what, As-Suffa should be doing this, the NHS should be doing this, my GP should be doing this, the counsellor should be doing this. Let's start inwards and say, you know what, we have to take some personal responsibility. And what should I, as an individual, doing? If I need help, there's no shame in me seeking help. If I'm able to kind of give some time back, I should give some time back. If I have some ideas which can better the community, put that into practice, do something. So I suppose that's from a perspective.
This stigma
just
about...
to follow on that as well, I wanted to just add what the brother said, which put quite well as well. Is that we have to meet people where they're at as well. If people all the sort of the youth and the wider society is on social media, we have to have some type of presence there as well, and we have to be able to kind of have a discussion and a conversation on those platforms as well, whether it's Facebook, Twitter, Instagram, these various social media platforms. What they are exactly what that is. They're platforms for us to kind of have these conversations. But if we're not a part of the conversation and we're letting other multi-million pound organizations fund and pump money into their agendas, then we're kind of letting them win in that way. So we have to be a part of the conversation and meet people where they're at. And at the moment, it seems like everyone is on social media, so we have to have some type of effort, and that's what we're doing here with the campaign, with videos that mashallah the brothers have put together, and the conversations like this, and to be a part of that conversation and be on those platforms and to have a presence on those platforms as well. So I think that's another aim of this project, really.
Okay, thank you.
Well, let's say one thing on help. On help.
Yes. So in terms of help, like I said, we have a website. Like this year, we've kind of.
I was going to say I wanted to contribute something.
Oh, so go on.
Yeah.
Go on. Sorry.
Yeah, it was just on help. Obviously, there's got to be a push from imams, leaders, doctors, etc. We've got to do that. But one thing I've noticed as well from the person suffering, they make dua to Allah, oh Allah, help me. But sometimes they miss that the answer to that dua might be the person coming to say, how are you, brother? Are you okay? Or someone comes into their life. Allah is answering people's du'as, but he may not answer it exactly how you expect. And when a brother or a sister comes into someone's life, that is the answer to your du'a. And you have to kind of, people have to be aware of that, that people are coming to help and they think Allah has abandoned them, they're not helping, but Allah is helping them through these things. And the best example of that is Musa alayhi salam, when he fled from Fir'aun and he had accidentally killed someone. He was homeless, penniless. Psychologically, he was really in some form of anxiety, trauma, because he'd killed someone accidentally. He had no help or anything. And the first thing he did was serve somebody else. He was more need than those girls in Madian when he was there, and he helped them, and he made dua straight after helping them. He made dua, that famous dua that everyone should learn who's in difficulty and not. Rabbi lima anzalta alayya min khayrin faqir. Oh Allah, I'm in desperate need of whatever good you send me. And what was the answer to that dua? The answer to that dua were those girls coming and inviting him back to their house to meet their father because he helped them. And so it was the action of Musa to help, even though he was in need himself, he helped someone else. And he made dua to Allah, and that dua came in the answer of those girls inviting him to the house. And so we have to be able to see those opportunities and those doors that open. And then as a result, Musa got a job for 10 years. He got a marriage, he got a job, a business, and he was set up for 10 years from one act of charity and kindness, one dua, and him being able to see the opportunity. If he sat under the tree and said, oh no, thank you, sister, I'm waiting for Allah to help me, that was Allah's help. And so that's important to realize the people who come in our life, opportunities that present themselves, that is Allah answering your dua. And we have to offer that solution, be there, but then people need to realize, keep themselves open to see where Allah's response is coming.
Thank you, Jazakallah. Dr. Abid, what does a medical journey look like? So if if I go to see my GP and say, you know what, XYZ, around anxiety, depression, or whatever, what's going to happen?
I mean, ideally, they would have a chat with you. Most likely, probably refer you to some counselling. That should be first line for kind of low grade, because the evidence for antidepressants for kind of mild illnesses, mild depression, anxiety is not great. Moderate to severe depression, if it's then medication may help. But so the first line really should be looking at counselling, talking therapies, and things like that. A lot of the time, the waiting lists are quite long, and so you may end up being offered antidepressants or medication because of that. But I think generally they would speak to you, offer you some sort of psychological work, and then they would, depending on how things then progress, really, if someone is really struggling, they need more support, or it's felt that they need medication, then that would be considered. And the GP may try and manage that for a short period. If they're still struggling, then the person's not really functioning, so they may not be working. There's other problems at home and things like that. They're not at the optimal kind of level of functioning. Then they would refer them on to secondary health care services, which would be our services, so like a community mental health team. So then that would be more, you see a psychiatrist, you may see kind of specialist nurses and things like that, and further longer term, more kind of in-depth psychological work and things. So that's generally how things progress if someone goes with day to day, depending on how they present, really.
Okay. Thank you.
Yeah.
That's fine. Any final thoughts or comments before we wrap up?
Sorry, Dr. Abid, can you just confirm whether mental health is one of those health problems that cannot be observed and monitored and be treated like any other illness? It's very hard to diagnose. So, it's, when people come in, they may think that then they got mental health issues, or they've got other problems that they want to make or feel that they got mental health. How can, as a doctor or someone who's in that position, differentiate between someone who feels that they got mental health, but basically they're confused about what they're trying to achieve, to someone who genuinely is suffering with mental health because of their trauma that they've suffered some time in their life, or they're going through a process in life where it's difficult for them to understand that that's what's affecting them. Medically, I understand that you said there are cutbacks and there's time limits, there's capacity, and therefore doctors are very quickly, because I'm saying this because I've got friends who unfortunately have been very quickly put onto medication when to be honest, from obviously dealing with them from as a friend and being with them, because they've been sharing their problem with me because they know that I've gone through something similar to them. And I'm saying that one thing you don't want to do is go through medication, because that actually has a lot. It may give you a short-term solution, but in the long term, it gives you a lot of side effects, which will actually come back to haunt you. It's more difficult. That's in my experience. You might.
Yeah, I think. See, it's with, I guess, mental health disorders. You're going to have a spectrum, and people don't always fit into boxes. So how we diagnose people will be speaking to them, observing them, speaking to family members. It's a holistic kind of approach, and ruling out your common kind of things first. But in terms of kind of, so some people may well reach a point that the only thing that is going to help them is medication, and they've tried everything else and things haven't kind of worked out. But everyone's different, so a stressor for you may be different compared to that same stressor for me. So for example, if somebody may kind of, I don't know, experience a loss of their cat or something like that, and that may lead them to become extremely depressed, anxious, because that was their only companion or whatever that was. For another person, they could go over that loss and kind of carry on. So people's level of resilience is different as well. So I think it's kind of, we have to take each person individually. So for example, if someone attempts to end their life, we have people that may take one tablet and they really felt they were going to end their life by taking that tablet. So that still is a serious attempt, because from that person, they felt that they could actually end their life by doing it, and they were in that state. Somebody else may take 50, 60 tablets, but they're doing it regularly. It's as a means of kind of, they just can't cope and they just take tablets. We probably won't be as concerned for that person, because they're not really doing it to end their life. It's just become a poor kind of coping strategy almost. So it really depends on each person and how they kind of, because the level of resilience and how they manage in difficult situations will be very different. And I think, with medication, what I will say is that there are side effects and there are problems, but I think for some people it can get to a point where it can be the only thing, and it can change people's lives as well. And I think it's kind of getting that balance. So if someone is, I think that's where kind of getting professional support and having the right assessments is important in those kind of cases, because I think we do see a lot of people that delay treatment. I've had people call me, somebody I knew quite closely who's educated, here. He got married, and he kind of told me about his wife. He called me out of the blue and said, she's, basically kind of describing psychosis. She's hearing voices, but she believed they were jinn. So there's jinns all over the house. They're in every single room. She doesn't leave the house. She's blocking up the windows. They're talking to her constantly. Clearly kind of psychotic, but he'd been going to one person to the next, to, back home to Bangladesh, and it'd been around 3 years. This has been going on. He's left his job just to try and manage this, and he was refusing to take her to a doctor to get medication. So that's the concern, that people get so worried about side effects and things like this someone like that left untreated for 12 months, 18 months, it becomes extremely difficult then to treat them and for them to respond to treatment. So I think it's really important that we have these conversations, but people get the right help as well. And when they need medication, that try and break down those barriers to some level, that actually, it can be helpful as well. Because I think there's still a lot of stigma around mental health services in general, because people do get worried about what will happen if they end up, in a mental health hospital and things like that. So, yeah.
That's interesting. Okay, so I suppose you want to add anything to that? Because obviously the thing is, yes, depending on who you go to speak to.
Yes.
If I go to see a imam, he might say, you know what, go down that route in terms of, evil eye, black magic, jinn, stuff like that. How, what's right and wrong?
So is this, obviously, jinn and shaitan it's a real reality, and this is part of going back to the original thing, is the correct conception of the soul and the human being, and we are being affected by these waswas, whispers of shaitan and jinn. That is a real thing, but that doesn't mean that every situation falls into that category. In fact, probably 99% of the cases are not, a jinn or black magic related. So I think that education element, people just jump to that conclusion straight away, but rather you should go to that conclusion at the end once everything else has been exhausted. Then you can maybe look at that, rather than doing it the other way around. So maybe that's, from the Islamic perspective, that's the best way to do it, from that kind of thing. But like waswas is a real thing, and alhamdulillah, our deen 1,000 years ago, the Prophet ﷺ, he told us about these things. Like, we have like levels of intention. So you start with, al-hajiz. So hajiz is just a thought that comes in your mind and goes away straight away. Then you have a khatir, which is where a thought comes in your mind, leaves straight away, and maybe comes back. It's like coming and going. Then you have hadithun nafs. Hadithun nafs is now when you actually give time to those thoughts, and you're not sure about doing it, but you kind of then dismiss it, but you give time to it. Then you have al-ham. Ham is like when you've got more certainty, you're going to act upon this thought. And then you have azm, when you've got 100 total like action. Now you're going to take action. And so Islamically, the scholars and our tradition in tasawwuf and tazkiyat of nafs, purification of the soul, they've allocated these thoughts. There's this level of thoughts, and those hajis and khatar, the very fleeting thoughts, they are to be ignored. And actually, these waswas from shaitan, they might be from yourself or they might be from shaitan. If you listen to those things, we know if you give them attention, like, then it becomes hadith or nafs, like you're actually giving value to those fleeting thoughts. Like, everyone might have, some of the companions said, Ya Rasulullah, some things come in our mind that if we mention them, we'd rather be shred apart than to mention them on our tongue. People get all like very disturbing thoughts, maybe, I don't know, to cut themselves, like, or jump in front of a train. People say these things. People get these random thoughts come in your mind, but a healthy mind dismisses it even easier than it came. But then when we start entertaining these thoughts, they get worse and worse and worse and worse. And so knowing this, it helps us deal with it. And we know waswas, the best way to deal with these whispers is to not give them any consideration. And the best way to do it, our ulama, they say, ghalabat al-dhann, which is preponderance of doubt. So like, if you're not sure you've made wudu, if you are like 51% sure you made wudu, 49% sure you didn't, then you dismiss the doubts. It's a principle in the Sharia, al-yaqeen la yazalu bi-shak, that yaqeen, certainty, is not removed by doubt. And so this all feeds into the concept of waswas, that not giving, first of all, understanding the level of thought. There's levels of thought. Not every thought is like a severe intention, and we need to be able to dismiss them and know how to handle them. Those persistent thoughts, we have to handle them by preponderance of doubt, that the more sure you are, if you're more sure that you've made wudu, then ignore any doubts. If you're more sure that you haven't broken your wudu, then ignore any doubts and carry on. And so alhamdulillah, our deen has this clear framework on how to handle it. And it's that lack of education, everything's waswas, all waswas should be listened to, everything's evil eye and jinn. You can go to two extremes. You can ignore the entire thing and say it's all made up fairy tales, and you go to the other extreme and say that every single thing is black eye and evil eye and black magic. And so we need to be handle it in a more educated way, the way that our deen teaches us, and remembering our adhkar, our daily remembrances. The fajr time and the asr time are spiritually important times, because that's the shift from day to night and then night to day. Just like your time, your difficulty will just like the world, darkness turns to light and light turns to darkness. It reminds us at those times we make our dhikr, our daily remembrances, that just like our difficulty is here, tomorrow it will be daytime, and then tomorrow you'll have ease, and then it will be difficulty again. And so, building this whole holistic spiritual view of things is really important. It's really important. And so we don't want to go to any extremes on either side of this black magic and waswas side of things.
Just to kind of develop what kind of Ustad Idris said quite eloquently there as well, is that we do try to kind of incorporate this within the counseling as well. With some people who are, more open to, and open to the idea of discussing their faith. Not everyone is ready for that. If you start speaking to someone who's been away from their religion, you start spilling details of the waswas and everything. They're not ready for that. So some people who are ready for that sort of understanding or have a prior understanding, we do try to incorporate that within the counseling and within the therapy. We do discuss the types of thoughts and the nafs as well, the different types of thoughts, where they're coming from. And we do try to apply this holistic understanding within the therapy, and to have this understanding that, there are, essentially four different, what the scholars have said, four types of thoughts, that come from shaitan, our nafs, ourselves, the angelic influence, and then others have said that there's also, directly from Allah, that sort of ilham, the inspiration that we get sometimes as well. So there are, these sorts of types of thoughts that we do get, and what we do in the therapy is work on our response to these thoughts. And for those that are willing to kind of go there, we do discuss, how to kind of appropriately respond to each different type of thought, whether it's obsessive, whether it's something that's playing on our mind, coming from whether it's sexual appetite, whether it's food, these types of thoughts, and how to kind of ignore them and how to kind of not act on them. Or in the other case, when it's coming from an angelic influence, how to kind of appropriately act on those and to kind of build our sensitivity really to those types of thoughts. And I think having this understanding does help to put things into a framework really or a paradigm of our world perspective as well. And it's important to have that understanding, especially as Muslims living in the West, where a lot of the therapy and a lot of the counseling is that you are your thoughts, whereas we understand that you're not just your thoughts, you're influenced by other entities. And so it's important to have that sort of separation there as well, and that's something that we do try to discuss if the person obviously is open to that within the counseling as well.
Perfect. Okay, guys, thank you very much. We have gone over time. Dr. Abid, any kind of final thoughts?
No, I think what you're doing is really useful, and I think we probably need more kind of outreach work. I would say, we were talking about breaking stigma. I think these kind of things and happening more in kind of mosques and community settings, with giving people the space to just speak and approach people, I think would be really helpful.
So inshallah, we are going to do a number of stuff. So obviously, I think in the kind of coming few weeks, we're going to be doing a series of kind of workshops, going a bit more into detail in terms of some of the kind of disorders. We'll talk about self-harm, suicidal thoughts, depression, anxiety, and they're going to be an hour-long workshops, but a bit more kind of focus on strategies. So it's difficult to go into detail in this kind of segment on basically on strategies and mechanisms of what we can do ourselves or advise other people to do. So inshallah, that's coming over the next kind of few weeks and months. There is a mental health first aid course which normally charges. So inshallah, we're going to try to kind of arrange that for imams and leaders of the communities, just so I suppose so people are kind of a bit more kind of comfortable, a bit more kind of aware are different things. And obviously, inshallah, also on the back of this and with everyone's du'as and support, we're going to do a number of things around the kind of mental health space and take it from there. So guys, Jazakallah khair for being part of this insightful discussion on men and mental health. To stay part of the conversation and to find out more, please join our mailing list at www.nhaw.co.uk.